So as we wrap up, there are several points of consideration. First of all, medical versus surgical management. In my opinion, clinical herniation requires surgery if the patient is salvageable, and medical therapy has very little role. If there's significant midline shift or effacement of the basal cisterns, if clinical herniation is imminent, then I think surgical intervention is appropriate. Craniotomy versus craniectomy, it really comes down to the degree of cerebral edema. I think all of us would favor craniotomy in these patients, provided that we are capable of doing this safely. And so why should new techniques be considered? There's certain advantages and disadvantages of both the traditional open technique and the minimally invasive. The open technique, there is no image registration or extra equipment to set up. You can proceed forward, and this is particularly important in centers where we don't do a whole lot of these particular procedures. And additionally, in the middle of the nighttime, when the staff is less familiar with the technology required for some of these, it's a quicker way. You can directly manage cerebral edema and be prepared for decompression, full-blown decompression if necessary. With larger openings, of course, the ultrasound has better angles to be able to see these things. But obviously, all of the problems that come with larger surgeries are a part of this as well. Larger openings, wound breakdown. If you do a craniectomy, it requires a cranioplasty. In my opinion, the minimally invasive procedures tend to take less time. The open procedures, in order to close them and get things wrapped up and everything else, tend to be a little bit longer, and I find it's more complication. Minimally invasive tends to be shorter, less dissection, shorter recovery time, and no cranioplasty. There tends to be some longer prep time, particularly in the early stages of getting used to this. And particularly in the MISTI technique, this is something that decompresses over days instead of right away. And so with that, I'll turn it over to my colleagues while we discuss the new trends.